What an opportunity. That's exactly what it was. It's an opportunity to create something new in Greater Kansas City.
The earliest challenges were really opportunities, and the opportunities presented themselves in a wondrous way, because as a startup foundation, there's no rules, there's no bylaws, there's no nothing. We have to create all that from the start, and that's the real opportunity we had.
We started with absolutely nothing. We needed to, first of all, I guess, become a cohesive team. We, of course, knew that at some point we needed to have a facility to operate. We needed to have a functioning staff. We needed to do all of those things. So I think those were part of what we saw as the opportunities to lay a solid foundation.
There were so many candidates, and they asked me a lot of questions about what I'd done and why I was interested in this. And I guess the interview must have gone okay, because I was selected by the governor to be on the board. And then the next thing I knew was I got a call from him asking if I'd be the chairman. And so I was named not only as a member of the board, but also to be the first chairman.
Dr. Jonas had a lifetime of teaching and at the same time working in the community, both his involvement with the university here as well as numerous areas. We felt that he was someone that everyone respected. Plus, he was very calm. And when you're dealing with hundreds of millions of dollars and political constituencies that want to get dollars back in their community right now, the thoughtful nature of Dr. Jonas, we thought, was very appropriate to begin this. As far as Gurney, I mean, he had a long history of managing people, both in his military career as well as in the city of Kansas City, managing 1,000 people. We thought that he would be a good counterbalance to help set that original staff up, because we knew we needed to have someone that not only understood the healthcare side and was going to be very even-handed, but we needed to set up an organization. And Gurney, whether it was for his military background or his background in government, in both of those areas, he had shown significant capacity to help build an organization.
Our biggest accomplishments in the first 5 years: we have an outstanding board, we have an outstanding staff, we have an outstanding ethics policy, and we've established a culture and a transparency in the community that I think is helpful to our work.
Our ethics policy says that we are to list and declare all of our potential conflicts. It ensures a process where board members who have some association with grantee or are involved somehow with a particular grant are not involved at all in discussion. They can't even be in the room, and they certainly can't vote for a program or a grant.
We've strived from day one to be as user-friendly and as transparent as possible. We never wanted to create a barrier to any organization that wanted to come to the foundation, so we've tried to be very service-oriented and to be helpful to those organizations in need.
In the beginning, I think people might come to the Healthcare Foundation thinking that they're representing an issue or a segment of healthcare, and I think they will find themselves, because of the culture that the Healthcare Foundation has established, maybe they transcend unknowingly into the bigger picture, that the mission is so important and it's so big, it really is big, that one, I think, will find themselves just totally embracing the bigger picture.
I think it's vitally important. It's the independent voice for healthcare for the area. It comes with assets that can make a difference if needed. It's a gap funder in areas where just a little bit more is needed. And when the board feels like they want to make a difference in something for a long pull for a number of years in a row, they can do that. But I think long range, this independent voice for healthcare, especially with the troubling and challenging issues we have facing this country over the next 5, 10, and 15 years in healthcare, will continue to be the most clear, salient voice for what needs to do to make a more healthy lifestyles and healthy outputs here in the Kansas City region.
Looking back at the past 5 years, the lessons for me have been more abstract. Being true to our principles, to make sure that we didn't compromise on what we thought were strong ethical principles and practices, and we've tried to do that. And to communicate and collaborate well, and we've tried to reach out to all aspects of our community and our service area. And I think those are important lessons for us to have learned and to continue on with.
I think the lessons learned for us is that we're continually learning. With every grant-making round, we get better and we realize that there might be a better way to do something, so we continually update and make any type of amendment or revisions to our process that might make it easier for organizations to apply.
Many of us are hopeful that there will be change in healthcare and access to health for the underinsured and uninsured. We don't know what those changes will bring, but it creates opportunity for the Healthcare Foundation to reinvent itself. And I believe it will create excitement for new board members, for staff, for providers, and for our consumers.
Of course, no one has a crystal ball to know where we're going to be in 5 years, 10 years from now. But I do know one thing, that money does not solve problems, people solve problems. And if we work together, we can do anything together. So hopefully this foundation will be involved working with the business community, the non-for-profit community, the political community, the policy community, the academic community, the church community, all working together to try to solve some of our most serious health and prevention problems. Prevention is important, health is important, healthcare is important. Our best days are ahead of us because working together with our entire community, we can make this a better community.